Good evening, everybody. This is a very good occasion and a happy occasion for me to be present in this August forum. I must thank Dr. Neetan Nair and all the other committee members for allowing us to share our journey about how we went about developing this product. So I am Vishwanath, I am from Irilic, and I without any much ado, I'll start the presentation. So what we have done so far is to develop a low-cost ICG system, which will help in things. So our journey started with two pioneers in the medical field, Dr. B.D. Vijaya, who is the head of R&D in GE earlier, and Sandeep Jaipurkar, who's a renowned radiologist. So they had just done a product on breast thermography and were looking for other alternatives. Then they started this fluorescent imaging 2015-16. And then we are all working with B.D. Vijaya and others for quite some time in terms of multiple things. We quickly joined them on this bandwagon and started to develop the product. The whole excitement came up based because it was a very new field for us. Hitherto we were developing only purely technological, what we call B2C kind of products. So what we had in the beginning was a limited exposure towards medical imaging, because imaging we knew any which ways, but how it's going to work in the medical field is what. So we had this knowledge of NIR fluorescence imaging, in what spectrum range it works, and then how it's going to work in the real field, more in terms of a schematic diagram. This is what we had came to know from our initial study. Then as we progressed a little bit in terms of the technological development, we laid hands on these two books, which gave more insight into what is fluorescence imaging, how it will be used in medical field, all those kind of things. This came because almost like a cornerstone for us in terms of looking up and where to go for those kind of things. So our road to innovation started in 2016. We had our first prototype done, and we took initial help of Dr. Sandeep to start seeing whether it's going to work. And he lab tested our prototypes and gave certain basic feedbacks, so that we could rapidly move into a system wherein which there's a predictability in what we are going to do it. So the second case was that we bought the testing into an in-house later on, so that we don't have to shift between Bangalore to Chennai. That's where Dr. Jaipurkar was there. And then we built our own phantom, so etc. for testing. The third and most important aspect of our journey is the concept of 3D printing. So instead of setting up a very costly manufacturing setup, we knew that we can 3D print our products within our organization without any dependency, and we can do as many iterations as possible. And that's how the whole thing was turned up. And it moved on. And then we had some kind of a semi-finished product in around 2017-18. And then just then we came in touch with Dr. Somshekhar, who really agreed to us to do the clinical trials. And actually our whole finesse of the product came with our working within the OT, because we could get the imaging, but what kind of other alterations are required, etc., the continuous improvement all came within the OT environment where our learning was the highest. So these are the few images of our probes which went through while we were doing the clinical trials. The initial trial had poor quality, no user interface, so the person has to go back to the screen and then do it. Second thing, we made the changes. All functionality was there, but ergonomically it was wrong. Then finally we did these two, and then we got into this mode of things. And again, in the ID aspect of it, we ideated into multiple things. And then now this is what we have been finally settled down. As you can really see, we have a clean box for our probe and all those kind of things, which is very handy and useful. Yes, we had a prototype. What next was the question? Because I know a lot of people who are in the medical field who always confess that they always have a technologically ready product, but neither clinically ready nor market ready. So this is where our thing was. And as a stroke of luck, we had Dr. Somshekhar, who helped us throughout, both in terms of the product development, also in terms of how it can be clinically useful, how it can be compared with the existing use cases and all those kind of things. And there we could rapidly progress into actually making a market acceptable products. Here are the publications which we have made from the products that we have made. And I think most of you are already aware of it. So currently, if I go back to this, our FGS fluorescence scanning system was designed and developed around 2017. We have done a lot of clinical trials from there. And then currently we are already certified, and we already have some leading customers as well. So if you look at the summary of our growth or our journey, so just succinctly tells us where we are, all those kind of things. In 2021, we are accepted in multiple premium hospitals as a vendor for the use case of our system in ICG use case in breast cancer SLN detection case. So our current progress is we already have one product. We are moving into LabPro very soon. So thank you very much.